everyone. There's lots of people here then. I'm not using a PowerPoint, so you'll have to look at me. My role, I work for West Suffolk Hospital, and my job title is Dementia Trainer Practitioner. And what that means is that I work with patients who have dementia, and obviously there's quite a few patients in West Suffolk Hospital who have dementia. About a quarter of our patients have some sort of cognitive impairment at any time. So that's about 100 patients at any one time. So obviously I can't work with all the patients. I tend to work with the people that are maybe struggling with the environment, or that the staff are struggling to manage, giving the staff advice about approaches, how to talk to people, etc. So what I'm going to talk about is diagnosis, and I'm going to cover a little bit about what's normal, what's not, because if I asked all of you what's the first sign of dementia, what would you say? Sorry? What's the first sign of dementia? Of course it is. And how many of us have memory loss? So how do you know if it's dementia or not? So I'm going to talk a little bit about that. I'm going to talk a little bit about why to seek help, so why to go and get a diagnosis, and I'm going to do some sort of basic communication techniques as well. So, dementia, what is it? I've got a definition here. It's an umbrella term that's used to describe types of brain disorders. There's over 100 different types, and all of the types include a mental decline that affects people's behaviour, their ability to use language, their ability to use new information. It affects visual spatial information. Have you seen people who maybe find it difficult to judge distances and sort of may see things that the rest of us don't see? And it also affects people's ability to plan. So for us, that would be knowing what the weather is, knowing whether to take a coat, knowing what time of day it is, and being able to plan our day and sequence our day. But if you've got dementia, those skills are affected. There's four main types, and I'm not obviously going to go into the details about the four main types. There's Alzheimer's, vascular dementia, Lewy body dementia, and frontal temporal dementia. They're all different, they all affect different parts of the brain, and they've all got different symptoms. And that's one of the reasons why it's quite important to get a diagnosis, so that you know what type of dementia it is. I'm going to give you some basic statistics. There's about 850,000 people diagnosed with dementia in the UK, but considering that about 50 to 60% of people have a diagnosis, and that leaves about 40 to 50% who don't, that 850% figure is probably a massive underestimate. The reason people don't get a diagnosis is because, well, there's lots of different reasons, but one of the reasons is because, you know, we all have memory loss, and how do you know whether it's dementia or not, and how do you know when to seek help? There's about 40,000 people under the age of 65 with dementia, so it's not just an older person's condition. There's lots of younger people with dementia. I think it's quite difficult to diagnose it for younger people, because if somebody is under 65 and they're presenting with memory problems, behavioural problems, it could be put down to depression. For women, it could be put down to the menopause, etc. So there's all sorts of other diagnoses that are given to younger people. And if, say 1, 2, 3, 4, 5, 6, if us 6 were all over 85, how many of these people do you think would have dementia? If you were all over 85, what do you think your figure is?
5.
You think 5 of the over 85s. Any other guesses? It's 1. So it's 1 in 6. So our perception is that it's much higher than it is. So 5 of you wouldn't and 1 of you would. If you get to be over 95, then it's 1 in 3. So the figures aren't as high as sometimes we perceive it to be. Suffolk's got an ageing population. This has a massive effect on us at the hospital. Suffolk's got, I think it's the second oldest population in the country, second only to Norfolk. I think that's right. So that obviously has a massive knock-on effect to us at hospital, but it has a massive knock-on effect because dementia is an ageing condition. It means that more people in Suffolk have dementia, so we should be getting it right. 38% of us know a person with dementia. Does that sort of ring true, do you think? I mean, it probably does, doesn't it? So that's over 30% of us know someone with dementia. And dementia costs the country over 24 billion, which is just a figure I obviously can't get my head around, 24 billion. And that's including health and social care. And the money that carers save the government is also included in that. So when to seek help? How do you know when to get help and when not to? Okay? So if I talk a little bit about what's normal for forgetting things, I'll give you a bit of a list. It's in my handout. Forgetting where you left things you use regularly, such as your glasses or keys, is quite normal, and I suspect we all do that, don't we? Do we forget names of acquaintances or blocking one memory with a similar one, such as recalling a grandson by your son's name? Is that something that you all do? That's normal as well. Anyone ever forget an appointment? Okay, that's perfectly okay. Having trouble remembering what you've just read or the details of a conversation, that's something that we all do. And walking into a room and forgetting why you entered, okay? Ever go upstairs and forget why? Yeah. Becoming easily distracted, and that depends on what else is going on. It depends what's going on in your life, who's around, how much noise there is, and not being able to quite retrieve information that you've got on the tip of your tongue. How frustrating is that? Okay? So they're all things that we do all the time. And the things that you need to be looking out for and beginning to worry about are maybe if you start to have difficulty performing simple everyday tasks that you've always been able to do. So the key thing is about change. You might find it quite difficult to do some of the things that I'm saying are signs of dementia anyway, but it's when dementia begins to have an effect and you notice changes. So it's like when you're trying to manage money, people often in the early stages find it quite difficult to run their sort of accounts. Unable to recall specific instances where memory loss caused a problem. So that's fine. What I'm saying there really is that you've forgotten that you've forgotten. So for instance, I may come out sometimes and forget my lunch, but I know I've forgotten my lunch. If I had dementia, I might not even remember that I had made my lunch and that I needed to bring it. So I remember that I've forgotten, but if you forget that you've forgotten, then that's a worry. Getting lost or disorientated in familiar places and being unable to follow directions. I should really put that one in the normal one because I am always lost and very unable to follow directions. I just switch off if someone tries to give me directions. But if I suddenly got worse, then it would be a pointer to look out for. Forgetting words. I mean, we all forget words, but it's when you begin to do it more often that it's an issue. And being repetitive. Sometimes, you know, we are repetitive. Have you ever sort of told a story to one of your friends and said, have I already told you this? So it's when you become more repetitive and in a short period of time as well. And trouble making choices. For instance, what coat to wear, where it's safe to walk, not able to decide what to wear or what to do, and becoming confused with choices. Finding it hard to follow TV programmes. Actually, sometimes I do that, don't I? Do you sometimes follow it hard to follow the television? Forgetting names, cannot recall things you've heard, seen or read, lose the thread of what you're saying. And I think if you were going through all of those symptoms, it wouldn't be that surprising if you felt anxious and depressed and angry, would it? It's not surprising that if you're finding that you're suffering with those symptoms that you're quite depressed. And the other big one is, and I think this is where most diagnoses come from, is finding that other people start to comment and noticing the changes. You may not notice it yourself, but it's when other people start to say, I notice changes in you, and you're more forgetful than you were, then I think it's a pointer. So how do you go about getting help? There's lots of people struggle with this. What's the first thing you'd do is go to your GP. But say it was my mum, and I was taking my mum to the GP because she had memory loss. My mum is quite likely to be very high performing at the doctors and do very, very well and present and answer all the doctor's questions perfectly. So how do you get across to your GP that that isn't what's normal? And I think it's one of the most common questions that I'm asked about diagnosis is how do I get through to my GP, who is our gateholder, that things aren't all as normal, when every time my mum sees the GP, everything appears to be fine. I would make some suggestions that you maybe write down some of the things that are going on. So make a list of some of the things that the person's doing at home. I would communicate with the GP maybe by writing to him, because how do you think the person with dementia would feel? How do you think my mum, if we use me as an example, if I went to the doctors with my mum and said my mum is forgetting everything, she's not cooking meals, she's forgetting appointments, she's got lots of personality changes, what do you think my mum would do if I sat there and said those things in front of her?
She'd deny it.
She would definitely deny it. And how do you think she'd feel?
Angry.
She would. And that just would not be overly helpful. So a good way to do it is to talk to the GP. If you can make an appointment and talk to the GP without the person, write it down so that you've got evidence of what's going on, and if for you it's a good memory jogger. The next thing to do is the GP, if he suspects that there may be dementia, he will refer the person to a memory clinic. Now, the memory clinic sounds like a sort of a clinic, doesn't it? But often, what will happen is the nurses from the memory clinic will come and visit you at home. And the reason they come and visit you at home is because actually, do you think it's quite stressful for the person with dementia to go to a memory clinic? The person, if I tried to take my mum to a memory clinic and there's nothing wrong with her memory, what do you think she's going to be like? She's going to be, and of course the letters say mental health trust. My mum is just obviously going to be very, very unhappy about being taken to a mental health trust for a memory clinic. So what the memory assessment team often do, they'll visit at home, a nurse will visit at home. They will talk to the person about their symptoms. They will talk to family and carers about symptoms as well. They will think about your medical history, about what's happened so far, about what sort of things are going on. And they will also try and do a physical checkup, so blood tests, and they may refer you for a brain scan as well, but not everybody has a brain scan. It depends on what sort of symptoms people are presenting with. They may also do a memory test, which is a very variable way of testing people, because some people perform very well in memory tests and some people don't perform so well. They're questions like, do you know where you are? You have to draw a clock, you have to spell world backwards, all sorts of things. Who's the Prime Minister, what's the date, etc. Okay? The tests, what they do is, it's not one specific test that decides on the diagnosis. It's talking to you, it's talking to the person who's got dementia, and it's looking at the history of the person, and family history as well, is how they make a diagnosis. If you don't want to know, or you don't want people to know about the diagnosis, that's up to you as well. With some types of dementia, people will be prescribed medication, and with some types they won't. And this will also be a time when you're given information about local support services, and sort of maybe you'll be entitled to claim some benefits as well. So you'll be given lots of information through the memory assessment team. Why seek help? Why bother? I mean, lots of people say, you know, there's no point in asking for help because there's no help out there. The reason to apply for, to try and get a diagnosis is because there is treatments for people. It gives you the opportunity to get the right treatment for the right kind of dementia, and also it rules out other conditions because there's other conditions that present as dementia. Depression, thyroid problems, other vitamin deficiencies present with dementia-like symptoms, so it's always worth getting a diagnosis. And I think it also gives you, and Nigel's going to talk about this later, it gives you the opportunity to plan for the future and decide what you want to happen, how you want your care to be delivered, and how you want your finances to be sorted out. So it gives you those opportunities to plan and make decisions for the future. Dementia as a diagnosis, the first thing people will probably ask is what happens next. It is so different for different people. One person's diagnosis is not going to be like another. There's lots of global symptoms that people will experience, but no one person experiences it in the same way. It's different for everybody, and the span of the dementia is different for everybody. Some pointers for good communication skills. I did an exercise yesterday at work with some colleagues, and I got a group of us to keep asking colleagues questions. Okay? How does it feel if you're constantly asked questions and you don't know the answers? I'll talk a little bit about good communication. So if you're asking questions and the person doesn't know the answers, you're right, they're going to feel degraded and put on the spot. So try to avoid asking people too many questions. What about arguing and contradicting with people? How do you think that goes down? How would you feel if every time you said something, someone contradicted or spoke over you? Do you think that would be positive?
Upset.
They would be upset, yeah. So try not to argue and contradict people. Keep it simple, so don't give people too many choices. Don't, sort of use words that people may not understand. The thing that you really need to do is adapt your behaviour, not the person. Don't expect the person with dementia to adapt their behaviour. You need to think about your behaviour and fit in with the person. And the most important thing is to support people to keep the skills that they have got. So if somebody can do something, carry on enabling them to do it. So are people able to live well with dementia? Are they able to still do things? Are they able to walk to the shop and sort of buy their shopping? Are they able to make a cup of tea, and are they able to still do the ironing? Yes, they are. People are able to do things that they've always done for a long time. People will have trouble learning new skills, but things that they've done for a long time, they will be able to continue to do. Okay? And then, I seem to have finished really early, sorry, does that matter? And then just some quotes from people living with dementia about how they feel. They said that swimming against the tide, so having dementia is a bit like swimming against the tide and walking with a group, but always being behind. And you can sort of understand that if you were going for a walk and the group you were with were always in front of you, you'd always feel a bit left behind, wouldn't you? And the things that people are afraid of when they have dementia, it's getting things wrong, and they're afraid of being a burden as well. People aren't afraid of forgetting things, they're more afraid of sort of being a burden, getting things wrong, and they're worried about their loss of identity too. Okay?